Chronic pain is a terrible thing. It affects 1 in 5 adults, and it's defined as constant pain for at least 6 months. Is it possible to eliminate chronic pain? I have been a chronic pain physician, a specialist, since 1996, and I have seen all kinds of people with a multitude of chronic pain conditions. When people ask me, "Doctor, will this pain go away?" my answer is, it depends. First, let me explain how pain becomes chronic. Then we can talk about reversing it. So, let's talk about setting SMART goals today. Pain starts with an insult, an injury, or a trauma. It generates an electrical impulse that travels through the peripheral nerves to the spinal cord. And in the spinal cord, it connects to another neuron that brings this electrical impulse to the thalamus, the processing center of the brain. From the thalamus, it sends messages to various parts of the brain that includes areas to localize the injury, areas of emotion and memory. The brain and the spinal cord will activate the inner pharmacist and send powerful painkillers, anti-inflammatories to fix the problem. If this process works as expected, then the injury is healed, the pain signals stop, and the whole system returns to the original sentinel state. However, there are circumstances when this cycle ends, but the body does not return to its original state. When this happens multiple times, the person will report that they always have some residual pain. They are never pain-free. It is like each acute pain is adding more to the system, and they just keep adding until the person cannot concentrate, sleep, or do anything. They are always in pain. The person tells me, there is no single minute of the day that I am not in pain. I am in constant pain every day. For the majority of people, this process takes years to fully develop, but for some, it may take weeks. This phenomenon is called central sensitization. Some factors predispose a person to develop chronic pain sensitization quicker than others. For example, adverse childhood experiences, smoking, lack of physical activity, poor sleep habits, all contribute to a worse prognosis. These individuals end up in pain clinics, and ideally they will see a multidisciplinary pain clinic where there are professionals specialized in pain medications, in mind-body therapies, in physical modalities, manual therapies, and movement, the 5 M's of the toolkit. These are the essential 5 M of treatment and management of chronic pain. Some pain clinics also offer injections and nerve blocks. However, these are mostly indicated when there is no central sensitization, and the problem is localized to a specific body area, body part, such as a lumbar disc herniation or a osteoarthritis of the hip joint. Before I move on, let me remind you that this video is for educational purposes only. For any individual medical advice, please consult your physician for diagnosis and treatment. Talk to your doctor. If you have an emergency, go to the nearest emergency department or call 911. So when we talk about pain management, it implies that there is no cure, that we are not aiming at eliminating or treating the pain. We are just managing the pain. Why can't we treat and remove chronic pain sensitization once for all? The answer is that we need to revert the pain system to the original state as it was before. We need to treat the pain system and eliminate the sensitization that occurred over many months or many years. Keep in mind that 100% reversal may not be possible, as there are neuroplastic changes in the nerve system that are ingrained in the hippocampus, the area that stores memory in our brain. Reverting pain is better than managing pain. Revert means to go back in this process and undo certain pathways that lead to the chronification of pain. Reverting pain takes time, effort, and consistency. And the multidisciplinary pain team will give the person all of the tools necessary to revert the process, but it's up to the person to use them. One reason that I see many patients failing and abandoning the process is when they do not set goals for their treatment journey. A person without goals will arrive nowhere. If the person does not see results, they abandon the practice. If the person has an unrealistic goal for treatment, they may expect that their pain will disappear completely in a couple of weeks, or that taking painkillers will eliminate the pain. And because multiple attempts to some sort of treatment for their pain have failed, they get discouraged and depressed. Then their lives go down on a spiral that is very dangerous. They rely mostly on passive modalities like taking pills, receiving manual therapy. They don't want to engage in physical activity, movement, or exercises because that makes their pain feel worse. Well, anyone who starts using some muscles after a long period of inactivity will feel muscle soreness. So this downward spiral leads to unhealthy behaviors like poor sleep hygiene, eating junk food, binge drinking, smoking cigarettes and cannabis, using more pills, less socializing, dropping from school and work, and they end up locked in their homes, watching TV and browsing the internet for the rest of their lives. It is impossible to coach an athlete that doesn't know their goals. It is very frustrating to guide a child who doesn't know what they want to become when they grow up. It is impossible to arrive at a destination if you don't know the address or the name of the place and the street where you're going. A chronic pain patient without SMART goals is like a pawn in the middle of a game without instructions. A patient with chronic pain must set smarter goals to revert the pain sensitization. When I say smarter goals, I'm using an acronym that stands for S, specific, strategic, and significant. M is measurable, meaningful, and motivational. A is attainable, achievable, and adjustable. R, relevant, realistic, and results. T, time relevant, tractable, and tangible. E, evaluable. R, readjustable and rewarding. Oh, before I forget, you can download a document that contains the script of this video. Go to the description of this video below and click on the link there. So this is an example of a smarter goal related to weight loss. The person has severe knee osteoarthritis and the doctor said they need to lose 50 pounds. The non-SMART goal looks something like, I will lose 50 pounds. The person that sets a smarter goal will say, I will lose 2 pounds per week for the next 4 weeks. Then I will stop eating any kind of bread, pasta, or white rice. I will replace them with grains, nuts, and steamed vegetables. And once I lose 8 to 10 pounds, I will evaluate if I'm able to lose more pounds per week. And I will celebrate by rewarding myself with a piece of dark chocolate. Here is another example related to exercising. The person has shoulder pain due to tendinitis, and the physiotherapist said that they need to do exercises. The non-SMART goal looks like this. I will sign up to a gym and I'll go every day for 1 hour every day. The person that sets a smarter goal will say, the first week I will do a home-based exercise routine for 10 minutes every day. Then I will increase to 2 sets of 10 minutes per day on the second week. And then I will increase to 3 sets of 10 minutes every day for the third week. And then I will increase to 4 sets of 10 minutes per day, but only 4 days per week, and I will rest 3 days per week. If this goes well, then I will sign up for a gym membership. An example of a smarter goal related to sleep routine. The person has insomnia, poor sleep quality, wakes up tired, and takes long naps during the day. The psychologist recommends the person to improve their sleep habits. The person sets a smarter goal. So I will go to bed every day at the same time, and I will set the alarm 8 hours later to wake up every morning at the same time. I will reduce the duration of naps during the day from currently 90 minutes to less than 30 minutes. Once I achieve this goal for 1 month, I will start a second goal to reduce the amount of blue light that I see during the day. When the person knows where they are going, it's easier for them to arrive there and to know when they arrived. It's important to remember that these are life changes. Just because they arrive there, it doesn't mean that they stop repeating these behaviors. They need to continue with these habits that helped them to work towards their goals to prevent flare-ups. No goal is too small. It is important to celebrate small achievements. I recommend my patients to keep a journal of their goals so they can see progress being made in the right direction. Once they achieve a goal, they can move to the next goal. Or they can have multiple goals at the same time, at different stages. So when I answer, it depends, it is because the answer depends on the person that has pain. If they are committed to learning how to revert their chronic pain by developing new daily habits and setting smarter goals. It is possible to revert it. Science has progressed, and we already know what works and what doesn't to revert chronic pain. I have seen many people reverting the course of chronic pain and achieving a better quality of life, one smarter goal at a time. Here is another video on my channel for you to watch, and here don't forget to subscribe to my channel. The majority of people who watch these videos are not subscribed yet. And click here to turn on the notifications so you don't miss when I post new videos on this channel. Goodbye!